According to the AFP, the news agency, Germany has reported what's thought to be the first human transmission of the new coronavirus in Europe, meaning that a person who didn't go to China was infected, but someone who was in contact with someone who did. How worried should we be about this?
I think if true, it's a significant development. The previous exported cases from China, and there are many countries now, there hasn't been any observed or noticeable human-to-human transmission. And so the fact that the first case in Germany was somebody who hadn't even travelled to China but had been in contact with somebody who had come back from Wuhan, I think also raises the concern levels, because it does mean that the virus, if imported into another country, can potentially spread.
And this plan of various countries to evacuate their citizens, to bring them back home, so to speak, is that a good idea, or is that potentially exposing people in their home countries?
I'm guessing if you're one of those affected people, it's a fantastic idea. But of course, in terms of the residents of the countries that they will be returning to, it's an understandable concern. But I think provided that those individuals are appropriately cared for when they return and monitored and hopefully even tested for the presence of coronavirus, then there should be no risk. And I think actually the real risk are the people who have already travelled to Wuhan and potentially other parts of China, who've returned to various countries around the world and might be carrying the virus, because we've heard that the incubation period can be up to 14 days, and it's even possible that some of those individuals could potentially be shedding and transmitting the virus. So that's where the biggest risk lies, and in particular in countries where surveillance and infrastructure isn't as well developed as it is in France, the UK, Germany, for example.
Now, we've seen a lot of people in China scrambling to get their hands on masks, face masks, and in certain cities you have to wear one in public spaces. What difference does this particular measure make?
In truth, in a hospital setting, it's a very effective means of preventing infection. It can work as well as a purpose-designed respirator. But most of the published data in the literature would suggest that in terms of community transmission of virus, there's no real evidence that it helps. And that's simply because people haven't been trained properly how to take them on and put them on and take them off safely. And it sounds silly, but there is a proper way of doing it. You have to avoid any hand contact with eyes, nose and mouth, etc. Of course, the mask itself can get potentially contaminated. So if it's worn for a long time, and also if it's worn for a long time, it can stop working. So unfortunately, out in the community, there's no evidence that it's a great benefit.
Now, as far as you know, have any of the lessons learnt from the SARS outbreak, that too originated in China and between 2002 and 2003 claimed the lives of hundreds of people, have lessons been learnt? Are there lessons being applied right now, do you think?
Well, there are several layers to this question about the SARS. Firstly, is SARS like the new coronavirus? Well, we think that might not be the case. We think this new virus might be behaving differently, and that means that we have different ways of having to get it under control. One lesson that we do have to learn is that back in 2002, there was a big warning to us all about things like trading in wild animals in these live markets, and the fact of introducing lots and lots of different species of animal into cramped conditions, potentially allowing viruses to spread amongst those animals, to amplify and then jump into humans. So I think of all of the lessons, that is the biggest to me.
Now, the World Health Organization took a while. It was debating whether or not to declare an international public health emergency, opted not to in the end. What do you make of that?
In truth, I was personally perplexed, but I wasn't privy to the discussions that were going on in there. In terms of declaring a public health emergency of international concern, one of the elements that they would consider is whether or not the host country, the country that was experiencing the problem, could cope on their own with dealing with it. And I'm sure that the Chinese authorities reassured WHO that they could get everything in hand. I think the reality is there are so many cases. Some people have reported, potentially some forecasters, epidemiologists, that there may be as many as 100,000 people infected in China. Of course, many of those have been travelling for the past few weeks. So it's a huge problem in China and also a big threat to the world.
All right, we'll have to leave it there. Thank you very much indeed for your time and your analysis. Jonathan Ball joining us there from the University of Nottingham in the UK.